Let me just begin by saying Jackson Health System will not run out of cash this fiscal year. Second, Jackson will not jeopardize the county's finances and bond ratings. Third, Jackson North, Jackson South will stay open for now. We have had our stakeholders, University of Miami, our doctors, our unions, other community leaders come to the table for additional funding, which you will see today presented. Like other safety net hospitals, Jackson still faces serious challenges, and today you will see how two plans will come together. First, our main priority, our cash stabilization plan. Second, as we work through the deficit of $230 million well into fiscal year 11. As I said, we have a restructuring team on board. We've got a CFO that will be on board tomorrow, and for that I'd like to thank this board.
We've identified roughly $184.6 million of additional cash help throughout the remainder of this fiscal year that would allow us to pay our bills. Actually allows us, if you can see at the second to the last line, start to pay down some of our accounts payable, to start to relieve some of the stress that our vendors have been feeling, and has been stretching their generosity and helping us as well. I will tell you that it is a reduction in force of 593 staff members across our organization. It also counts some newly vacated positions through retirements and resignations. And it also recognizes the equivalent, the full-time equivalent cash reduction of overtime and outside agency purchases that are used to supply our services. It's a plan that would, as you have requested, demonstrate no hospital closures. It would also recognize, thank you. The goal is, and we must be committed to delivering on the goal, we have to live within our means. We had conversation earlier today with SEIU to talk about this and presented what our request is for their contribution level. And as I indicated earlier, there are probably a number of different ways to achieve that, and we need to continue those conversations over the next day or two or three to arrive at hopefully a way to make it happen.
Although we have worked on a very immediate plan, because it is the urgency that is taking us, the issue with the county as far as the cash is concerned, I also don't want to leave here saying that there's not a lot of work still to be done. There are still challenges that we need to face. There's still a deficit we need to close. And therefore, you know, now we do have our partners here, and we are going to be working very diligently within the next 30, 45, 60 days so that we can really present not only a plan for this deficit, but more importantly, the sustainable model that we can work with within our means.
I'm a little bit concerned about what we presented to the public a week ago and what we're presenting today, and which report will the community believe?
This new plan, because we went out and looked and, you know, came back with our partners, you know, whether the state, local partners, etc., now we're able to kind of work through the cash position, which is the most important. So that was our first job. We needed to secure that we had cash to pay our bills, our vendors, our employees through the fiscal year, September 30th.
Is this 100%? You heard it. It's not 100%. But you know what? There's a high degree of confidence that one way or another we can find these kind of dollars to get us through this year. And we've brought in enough people and talent to help us get there. And with the time they've had, I think they've done a very, very good job of helping us get through that. So is this over? No. We are still, if I can use the mayor's word, in a financial urgency. We are. Because this is just to get us stable enough so we can write some checks and pay some bills and keep the doors open and continue to maintain quality of care, a high degree of quality of care, so that we can find the better medium term, which is next year, and then long-term solution to our issue. Because at the end of the day, our issue still has not changed. Is this 100%? You heard it. It's not 100%. But you know what? There's a high degree of confidence that one way or another we can find these kind of dollars to get us through this year. This is just to get us stable enough so we can write some checks and pay some bills and keep the doors open and continue to maintain quality of care, a high degree of quality of care, so that we can find the better medium term, which is next year, and then long-term solution to our issue. Because at the end of the day, our issue still has not changed.